Good morning. I'm so grateful for the opportunity to join Dr. Drake and the other panelists this morning for such an important discussion. Historically, we've focused more on the crisis end of providing services, and while I truly believe that's important, I also believe we must really commit to the front end. So prevention, early identification, and early intervention so that we can have a greater impact on people's recovery. If we want to become a system of care that is truly recovery oriented versus reactionary, we need to start addressing the root cause of so many issues: childhood adversity, adverse childhood experiences, adverse community environments, and racial and health inequities. We know that early adversity are traumatic experiences that can have a profound effect on a child's developing brain and body, with lasting impact on a person's emotional and physical health throughout their lifespan. Research has shown that 1 in 3 adult mental health conditions relate to adverse childhood experiences. In the original 1985 Kaiser study, we understood the outcomes that early adversity can have on adult health. We now know the how, and that the biological mechanism is our stress response system and toxic stress. As I'm sure you know, toxic stress is defined as an extreme, frequent, or extended activation of our body's stress response system. Early adversity leads to a disruption in our neural development. It actually changes the shape of our brain. This disruption leads to social, emotional, and cognitive impairments. Impairments in these areas interfere with our ability to have healthy relationships, to maintain employment, to even regulate our emotions. And once that happens, people begin engaging in high-risk behaviors, things like excessive drinking, promiscuity. All of this acts as a domino effect and leads to disease, disability, and social problems. That's when you start to see serious physical health issues like cancer, heart disease, diabetes, as well as mental illness, schizophrenia, bipolar, anxiety, and depression. And ultimately, there's a shortened life expectancy by as much as 20 years. The most fascinating point, as well as what I believe should be a significant area of our focus, is that toxic stress is passed down from one generation to the next. It is transmitted from parent to child more consistently than any other genetic disease. However, not all childhood adversity has a negative impact, and that we have found having one buffering adult in a child's life can profoundly impact them for the better. Toxic stress affects our earning potential, how we learn, our parenting approach, our ability to have healthy relationships, what we create in our communities, as well as the very idea of what we believe we are capable of. This information is fundamental to addressing health inequity and the social determinants of health, because when you bring everything down to a cellular level, then it's all about all of us, and it's no longer an us versus them conversation. I was so glad to hear Dr. Drake bring up prevention and the social determinants of health, because the second component necessary for a recovery-oriented system of care will require that we understand how social determinants of health impact our health outcomes. If we think about Maslow's hierarchy of needs, we have to remember that people's basic needs are safety, shelter, and food. If the community we live, work, play, or worship in is unable to provide any one of those areas, then that will have a detrimental impact to our mental and physical health. In order to develop a system of care that is recovery-oriented, we must engage in a diverse group of stakeholders in developing policy goals, policies that will support efforts to address adversity that is embedded in our communities, but have their roots in our systems. Think about what could happen if our system could begin screening for adverse childhood experiences, and we began helping a pregnant woman understand her ACE score and how that would impact her child. And this was all done through a lens of equity versus judgment. The initial investment in that family would be vastly different than if we wait until the child starts to display social or cognitive impairment. Or 10 years later, that same mother has to go to a doctor because now she has diabetes or cancer. Not only could we strengthen the families and communities, we could redistribute money to invest in building equity within our communities throughout the state. All of this simply perpetuates the problem of framing it in terms of us versus them. It's either we get ahead or they do, and fighting for resources that fragments efforts to solve the same problem. The science shows us that it is not us against them. We share a common enemy, and that is childhood adversity. And that should be at the core of building a system of care that is committed to recovery that starts with the foundation of prevention. Thank you.